If you haven't got the picture yet, Mirabegron is a new class drug licensed to manage an overactive bladder. It has been used in common medical practice for the past 30 years. It was discovered by Astellas Pharma Incorporated in Japan and was licensed for the treatment of overactive bladder. It was approved for use in Japan in 2011, 2012 for USA and Canada, and 2013 in the UK. So to briefly describe what the condition Mirabegron treats, it treats overactive bladder, or OAB. This is defined as a syndrome categorized by urgency and frequency of urination with or without involuntary control. OAB sufferers commonly experience nocturia as well. 16% of OAB rises with age. It occurs in both males and females and has a significant impact on the quality of life. As for Mirabegron's mechanism of action, it is an agonist of the beta-3 adrenergic receptor, or beta-3-AR. Beta-3-AR relaxes the urinary bladder detrustor smooth muscle. Being an agonist, Mirabegron selectively activates these receptors and relaxes the detrusor smooth muscles during the storage phase of the urinary bladder fill void cycle, thus increasing the bladder capacity and its ability to store urine. As with many pharmaceuticals, Mirabegron is responsible for a series of side effects. The most common one in the administration of standard Mirabegron 50 mg is dry mouth, a side effect typical of antimuscarinics. Less common symptoms include increased blood pressure, tachycardia, urinary tract infections, constipation, headache, back pain, dizziness, palpitations, atrial fibrillation, and joint pain and swelling. Importantly, practitioners should be cautious in administering Mirabegron to patients with severe uncontrolled hypertension. As such, blood pressure should be checked before starting treatment and monitored regularly during treatment, especially in patients with general hypertension. Regarding its clinical efficacy, Mirabegron has been studied extensively in more than 10,000 of OAB patients in various countries of Europe over more than a decade. Mirabegron was compared in different doses with tolterodine, an antimuscarinic drug that is used for symptomatic treatment of urinary incontinence, and it was placed in placebo as controls. The assessment was conducted every day for 3 months. Mirabegron was significantly superior than others in regards to the mean volume voided per micturition and mean number of incontinence episodes. This is shown in Figure 1. Now we look into the safety and tolerability of Mirabegron. Many trials has been done in accordance to the European, Australian trials as well as the North American trials that demonstrate the highest safety of Mirabegron in comparison to the antimuscarinic drug tolterodine, particularly to the serious side effects such as high blood pressure, urinary tract infection, tachycardia, and the dryness of mouth, as shown in Table 1 below. Table 1 illustrates parts of the serious side effects percentage that occur in Mirabegron. A single dose of 50 mg and tolterodine sustained release 4 mg. There are high differences in the safety scale between these two medications, particularly in the serious negative impacts. Whereas the specific dose of 50 mg of Mirabegron show high tolerability in comparison to 100 mg of the same medication and tolterodine antimuscarinic effects within 12 months. This demonstrates the stability of the effect of this medication in the long duration, as shown in Figure 2 below. Figure 2 shows the tolerability of the Mirabegron in 50 mg, Mirabegron 100 mg, and tolterodine SR 4 mg in 1 year duration. The Mirabegron 50 mg shows sustained tolerability than others. Now we move on to the clinical and social impact of the drug. There are many positive impacts in regards using Mirabegron include improving the clinical cases of overactive bladder syndrome OAB, thus leading to the increase in benefits gained from reducing healthcare resources and lower the cost related of treatments in comparison to other antimuscarinics. This will eliminate the financial and economical burdens as shown in Table 2 below. Table 2 shows the market share in accordance with Information, Services, and Technology for the Healthcare Industry, IMS, Health Data 2014. The assumption during 3-year horizon primary-secondary analysis. The primary analysis shows the increment of Mirabegron use in population A. There is switching in treatment from anti-muscarinics towards Mirabegron, whereas no movement was shown from population B. The secondary analysis explained the consequences of switching 1% more of the untreated population each year toward the treated population to initiate treatment with Mirabegron. Mirabegron is well tolerated with significant efficacy in reducing the number of incontinence episodes and the mean micturition frequency, as well as serious side effects other than muscarinics. The muscarinic receptors are available in other parts and organs in the body, such as in salivary glands, ciliary muscles of the eyes and colon, and producing extra side effects from the anti-muscarinics versus limited side effects of selective beta-3 agonist Mirabegron. Mirabegron has the potential to treat obesity and diabetes via raising the expenditure of the energy through endogenous brown adipose tissue activation. Mirabegron has significant effectiveness towards many financial and socio-economical areas by solving many health issues. However, it has some impacts that can limit using this medication, such as Mirabegron can initiate hypertension and produce serious adverse effects for those who have hypertension, contradicting to those people who have heart problems and high pulse rate because of tachycardia that might occur during the medication. Mirabegron should not be used with those who have severe liver and kidney problems, and it is not recommended for those under 18 years with caution using the medication with elderly people. Now we compare Mirabegron to existing recommending drugs. Mirabegron alternatives can be compared with other drugs of the same class and can be effective if Mirabegron is not the ideal drug of choice. These anticholinergics include darafenecin, also known as Enablex, oxybutynin, which have subtypes of ditropan, oxytrol transdermal systems, propanthelin, also known as probanthine, sulfanicin, also known as Vesicare, and teltyrodine, also known as Jutricitol.